If you ask 10 people what the best healthy diet is, you are going to get 10 different answers. One person will tell you that you have to cut out all the carbohydrates, go keto, maybe even carnivore. The next person will tell you the opposite, that you have to drop the meat and go vegan. And then there is Mediterranean and DASH and paleo, and a dozen more. After more than 15 years of practicing internal medicine and helping my patients use food as medicine, here is what I have found. Handing someone a strict diet usually does not help them. Most people, not everyone, but most cannot stick to a very restrictive plan for very long, however good it looks on paper, and a diet does nothing for your arteries if you cannot stay on it. So, the way I see it, a nutrition plan that is only 70% perfect, but that you can follow for the rest of your life, will beat a plan that is 100% perfect, but that you quit in 6 months every single time. So here's the goal for today. Find the handful of high-yield foods that keep showing up again and again across the big studies and the meta-analyses on heart disease and get them into your routine, whatever your routine happens to look like. As we go through them, I am also going to show you a few foods that get sold to you as heart healthy that you actually need to be careful with. And at the very end, I am going to give you the one type of exercise and the one supplement that have real evidence behind them for reversing plaque even faster. One quick thing before we get into the foods. If you are in your 60s, or you can feel 60 coming, and what you really want is to live longer, stronger, and healthier with a heart that keeps up with the life you actually want to live, I took everything I tell my own patients and put it into one simple plan. It has already helped thousands of people feel steadier, stronger, and more in control of their health after 60. The link is on your screen right now. You do not have to write anything down. Just go and take a look once we are done here. Now, before we get to the best foods, you have to understand how plaque forms in the first place, because once you understand that process, you can be far more precise about which of these foods you personally need to lean into. Everyone's risk is a little different, and what matters most for one person may not be the thing that matters most for you. Arterial plaque is not a simple thing, and that is the first place most advice gets it wrong. It does not come from one number on a lab report. Cholesterol gets all the blame, but high cholesterol on its own does not build a plaque. Neither does high blood sugar by itself or high blood pressure or inflammation. Plaque forms when several of those line up at the same time and start feeding each other. Let me walk you through it because it only takes a minute and it changes how you eat for the rest of your life. It starts with an injury to the endothelium. That is the thin, delicate, single layer of cells that lines the inside of every blood vessel you have. High blood pressure scrapes at it. High blood sugar makes it irritated and sticky. Add in smoke or toxins in the damaged compounds. Once that lining is roughed up, it gets leaky. Then the cholesterol particles move in, specifically the LDL particle, and even more specifically a protein riding on its surface called APO. APO is the part that actually burrows into the wall of the artery. Once those particles are stuck in there, inflammation goes to work and oxidizes them, which just means they get chemically damaged, almost like they go rancid. And that rancid oxidized cholesterol is the alarm bell. It calls in your immune system. Your white blood cells, the cleanup crew called macrophages, rush to the site to clear up the mess. But they get overwhelmed. They get stuffed full of oxidized cholesterol, and they get stuck. That growing pile of bloated immune cells and damaged cholesterol is the plaque. And the more oxidative stress in the area, meaning the more chemical damage floating around, the more the whole cycle repeats and the bigger the plaque grows. So if you want food to fight that process, the food has to do 4 specific jobs. It has to lower APO, the particle that does the burrowing. It has to bring down inflammation. It has to improve your nitric oxide, the gas your artery lining makes to relax and widen the vessel, which also lowers your blood pressure and protects that lining. And it has to calm down the overreactive immune response that turns a small repair job into a growing plaque. Every food I am about to give you hits at least one of those 4. The best ones hit several at once. Real quick, if this is already making more sense than the last 10 heart videos you have watched, do me a small favor. Hit subscribe, give this a like, and leave me a comment telling me your age. The age of the people watching genuinely decides which topics I cover next. So the first food is built around a compound called lycopene, and if you only changed one thing after this video, this would be a fine place to start, because lycopene goes straight at the oxidative stress we just talked about. the chemical damage that keeps the plaque cycle spinning. Lycopene is a carotenoid. That is just the natural pigment that makes certain fruits and vegetables red or pink. You get it from tomatoes, and you get even more of it from cooked tomatoes. So tomato sauce, tomato paste, even a good plain tomato soup. You also find it in watermelon, in pink grapefruit, in guava, and in papaya. Here is why it works. Lycopene is one of the most powerful antioxidants we have in the diet. Remember that one of the main engines of plaque is oxidative stress, the damage done by unstable molecules called reactive oxygen species. Lycopene goes around neutralizing those molecules before they can chew up your cholesterol and your artery lining, and we have the human data to back it up. There is a long-running heart study out of the University of Kuopio in Finland that followed thousands of people for years. The researchers found that people with higher lycopene levels, often from tomato foods, had measurably less thickening and less early plaque in their carotid arteries, the big arteries in your neck that feed your brain. Higher carotenoid levels lined up with slower progression of early atherosclerosis. One simple move, a few servings of tomato through the week, ideally cooked and with a little olive oil so you actually absorb it, and you are working directly against the part of the process that is hardest to stop. The second food group goes after the cholesterol particle that does the actual burrowing into your artery wall. These are foods rich in phytosterols, and the way they work is genuinely clever. So stay with me because this one surprises almost everybody. Phytosterols are plant compounds shaped almost exactly like cholesterol. You find them in nuts and seeds, especially flaxseed and sesame seeds. You also get them in legumes, in whole grains, in avocado, in carrots and broccoli, and in leafy greens. Because they look so much like cholesterol, when they reach your gut, they compete with cholesterol for absorption. They take up the parking spaces, so less cholesterol from your food actually gets through. But the bigger effect happens upstream in your liver, and almost nobody gets told this part. Most of the cholesterol in your blood does not come from the cholesterol you eat. It is made inside you by your liver. So when your liver senses that less cholesterol is coming in from the gut, it does something useful. To keep its own balance, it starts pulling LDL particles out of your bloodstream to make up the difference. And every LDL particle it pulls out is an apo particle taken out of circulation, one fewer particle that can burrow into your artery wall. And apo matters more here than almost any other number. When you look at the meta-analyses and especially at the Mendelian randomization studies, which are about as close to proof of cause as we get without running a lab experiment on people, ApoB comes up again and again as one of the true drivers of plaque. Not the only one, but a central one. And the pooled trials show that eating more phytosterols meaningfully lowers LDL on the order of about 14 milligrams per deciliter for a lot of people. A handful of nuts and a spoon of ground flax in your day is quietly pulling burrowing particles out of your arteries. The third food goes after the stickiness, because before a plaque can grow, the wall of your artery has to become sticky enough for immune cells to grab on. The foods that fix that are rich in flavonoids. Flavonoids are the natural compounds that give a lot of plants their deep color. You get them from berries, from apples, from oranges, and onions and leafy greens. And there is a good amount in dark chocolate, the real kind, not the candy. Walk back through the process for a second. When LDL gets trapped in your artery lining and oxidizes, the area turns sticky. The wall starts expressing what are called adhesion molecules, little Velcro hooks that grab passing white blood cells, your macrophages, and pull them in to start the inflammation that grows the plaque. Flavonoids turn down those adhesion molecules. They make the artery wall less sticky, so fewer cells get caught, the inflammation stays lower, and the macrophages that do show up behave in a calmer way, instead of turning your cholesterol rancid. One family of flavonoids deserves its own mention, and that is catechins, which you get from green and black tea. A 2009 meta-analysis published in the journal Stroke pulled 9 separate studies and found that people drinking 3 or more cups of green or black tea a day had about a 21% lower risk of stroke compared with people drinking less than 1 cup. 3 cups of tea, that is one of the easiest changes on this entire list, and it is working on the exact stickiness that lets plaque take hold in the first place. The fourth food might be the single most studied food for the heart on this whole list, and it does something none of the others quite do. It helps smooth over the damaged lining itself. I am talking about extra virgin olive oil. Extra virgin olive oil keeps coming up across the research and high intake lines, up with a real drop in major cardiovascular events, the heart attacks and strokes we are all trying to avoid. The clearest evidence comes from a large Spanish trial called Predimed, published in the New England Journal of Medicine, where adding extra virgin olive oil to people's diets was tied to a significant reduction in those major events. The reason is in what olive oil is made of. It is loaded with polyphenols, which are antioxidant and anti-inflammatory compounds, and with monounsaturated fat, the kind of fat that calms an artery rather than inflaming it. Together they help soothe and smooth the damaged endothelium, that irritated artery lining where the whole problem starts. On top of that, olive oil can improve how your body handles insulin and bring down inflammation more broadly. So, with one ingredient, you are hitting several steps in the plaque process at once. Use it as your main fat. Pour it on the salad, cook with it, finish a soup with it. Just make sure it actually says extra virgin, because that is where the polyphenols live. The fifth food brings in a nutrient your body cannot make on its own, and that does some of the most important repair work of all: fatty fish. I am talking about salmon, mackerel, and sardines. These fish are rich in the two marine omega-3 fats, EPA and DHA, and those fats are central to keeping your heart and blood vessels healthy. The clinical studies are consistent. People who eat fatty fish 1 to 3 times a week have a lower risk of heart disease and stroke. One of the largest and longest-running heart studies in the United States is the multi-clinic study of atherosclerosis funded by the National Institutes of Health. It found that people with higher DHA levels had roughly a 12% lower risk of the plaque in their corrotated arteries getting worse. The same neck artery plaque that can throw a clot to the brain and cause a stroke. Those omega-3s do two things. They calm the immune overreaction that aggravates plaque, the same overactive response we keep coming back to, and they help raise nitric oxide, which relaxes your vessels, and just as important, help stabilize the plaque you already have, making it less likely to crack open and trigger a clot. If you cannot get fish in 2 or 3 times a week, this is one of the few cases where I think a good omega-3 supplement is worth a conversation with your doctor. Now, I promised you the other side of this. The foods that get sold to you as heart healthy and can quietly work against everything we just covered, because you can do all 5 of these foods right, and still feed the plaque if these are sitting in your kitchen. The first principle is simple. The most inflammatory foods for your arteries are the processed carbohydrates and the foods full of sugar and fructose, the pastries, the sweet cereals, anything built on refined sugar. Most people over 60 already know that the problem is the foods that hide. Start with flavored yogurts. A lot of them are packed with added sugar, sometimes as much as a dessert. You are far better off buying plain full-fat yogurt and adding your own sweetness. A little honey, some berries, whatever you like, so you control how much goes in. Then there are the bars. Most people have figured out by now that the average breakfast cereal is basically dessert in a box. But the granola bars and breakfast bars that market themselves as the healthy choice are often just as loaded with sugar, only in nicer packaging. Turn the box over and read the label. The sugar number does not care about the words on the front. And then the sneaky one I bring up with almost every patient: juice. Apple juice, orange juice, any of them. When you drink juice, you are taking in a big concentrated dose of sugar. And here is the trap. Even when the bottle says no added sugar, only natural sugars, those sugars are still hitting you fast and concentrated, and the juice has been stripped of the fiber that would normally slow it all down if you ate the actual fruit. Whole fruit is genuinely good for your heart, but it is very easy to overdo sugar and fructose when you are drinking it instead of eating it. So eat the orange, skip the orange juice. Alright, as promised, a few things beyond food that help you reverse plaque faster. The first is exercise. And I want to be specific because one type has actual evidence behind it for shrinking plaque, not just preventing it. Any movement is good for your heart, but the standout in the research is high-intensity interval training, or HIIT. That just means short bursts of harder effort with easy recovery in between. A minute or two of pushing past comfortable, then an easy stretch to recover repeated several times. Nothing close to an all-out sprint. There was a randomized controlled trial published in the European Journal of Preventive Cardiology where people did 6 months of supervised high-intensity interval training. At the end, they showed a real reduction in plaque volume. And the part that genuinely stopped me, The amount of plaque regression after those 6 months was slightly larger than what is typically seen with statin therapy in that kind of measurement. Now, a fair caution: atherosclerosis builds over decades, so we do not yet know exactly how that plaque change translates into fewer heart attacks down the road. But for an exercise that costs nothing and helps your blood pressure, your blood sugar, and your mood at the same time, those early results are remarkable. If your doctor has cleared you to exercise, this is the kind worth building toward. The second bonus is the one supplement on this topic that actually has decent evidence behind it, and it is probably not the one you would guess: aged garlic extract. And I mean aged garlic extract specifically, a particular in a double-blind randomized control trial. Aged garlic extract was shown to help stabilize vulnerable plaque, the soft unstable kind that is most likely to rupture and cause a heart attack. And in a separate randomized trial, the group taking aged garlic extract for a year had less progression of coronary artery calcification. That is calcium building into the plaque in the arteries that feed the heart, along with improved blood pressure. A lot of that work has come out of UCLA. It is not a magic pill, and you should run it past your doctor, especially if you are on a blood thinner. But of all the supplements people ask me about for their arteries, this is the one with the most real evidence sitting behind it. One more, and this one is a bonus on top of the bonus, something I genuinely recommend to patients who have access to it: sauna. I want to be honest about the evidence here. We do not have direct proof that sitting in a sauna shrinks or stabilizes plaque. What we do have is a large and growing body of indirect evidence. There are studies showing that regular sauna bathing improves endothelial function, the health of that same artery lining we keep coming back to. There are meta-analyses showing sauna use helps lower blood pressure. Much of the strongest work comes out of Finland, where they have followed sauna users for decades, and it links frequent sauna sessions with a significantly lower risk of dying from heart disease and from any cause at all. Most of that is observational and mechanistic, so I hold it a little more loosely than the food evidence, but it is a pleasant low-risk thing to add, and the indirect data behind it is strong enough that if you have access to a sauna, I think it is well worth using. Let me put this all together with a patient I will call Frank. Frank came to me at 64, not long after a friend his own age dropped from a heart attack. His scan showed real plaque already building in his arteries. He did not want to just take a pill and hope, so we did exactly what is in this video. Tomatoes and a little olive oil most days, a handful of nuts and ground flax, berries and tea, fatty fish twice a week. We cut the juice and the granola bars he thought were healthy. He worked up to interval walking 3 times a week, and he added aged garlic extract. Within months, his blood pressure was down, his ApoB was down, and on his follow-up imaging, the plaque had stopped advancing. That is what this looks like in a real life. So here's what I want you to actually do this week. You do not need all of it at once. Pick a few and start. 1. Get tomatoes into your week cooked with a little olive oil so you absorb the lycopene. 2. Put a small bowl of nuts in a bag of ground flaxseed, where you will see them and use them daily. 3. Berries most days and swap 1 drink for green or black tea, aiming for around 3 cups. 4. Make extra virgin olive oil your main fat and read the label so it really is extra virgin. 5. Fatty fish, salmon or sardines or mackerel 2 times a week, and cut the liquid sugar, the juice, the flavored yogurts, the bars in healthy packaging. That one subtraction protects everything else you are doing. Then when you are ready, layer on the bonuses: the interval training, the aged garlic extract, the sauna if you have one. One important line before I let you go: everything here is about lowering your risk and supporting your arteries over the long run. It does not replace the medication or the screening your doctor has you on. If you are on a statin or a blood pressure drug, do not stop it because you started eating tomatoes. And if you ever get chest pressure, pain spreading into your arm or jaw, or sudden shortness of breath, do not reach for a healthy meal. Call an ambulance. Food changes your odds over years. It is not how you handle an emergency that is already happening. Here is the last thing, and it matters. We spent this whole video on ApoB and LDL, the particles that actually drive plaque, but the standard cholesterol panel, the one your doctor runs by default, can miss the most dangerous part of that picture entirely. There is one blood marker most people over 60 have never had checked, even with totally normal cholesterol, that quietly predicts heart attack risk better than the numbers you have been watching for years. I made a video on exactly that, the one test to ask your doctor for, and how to read it, and it is on your screen right now. Go watch that one next. I think it is the single most useful number you are not tracking. I'll see you over there.